I'll start by checking for past and present history, as well as OPQ, RST, and sample. Then I would inspect for discoloration, deformity, swelling, genu verum, genu valgum, genu recurvatum, as well as gait. Then you'd start with bony palpations. For the tibia, it would be you palpate the shaft of the tibia, as well as the tuberosity and the plateau. Then for the femur, you palpate the condyles and the shaft. For the fibula, you palpate the head of the fibula and the shaft. And then for the patella, the borders and the body, checking for fracture. Then for soft tissue palpations, you do the MCL or medial collateral ligament and the LCL or lateral collateral ligament. Then the menisci at the joint line, the lateral and medial menisci. The popliteal fossa, which is back. The patellar tendon. Then for quadriceps, the rectus femoris, vastus medialis, and vastus lateralis. Then the pes answering group. Then would be hamstrings. Head over. So for hamstrings, it would be the biceps femoris, semimembranosus, semitendinosus, and then for back now, then it would be your iliotibial band, which is on the side here, IT band. Next, we would go into range of motion. So I would test both active and passive. Here I'm going to do passive, so we'll do knee, no, don't do anything, like I'll help you through it. It'll be flexion at 135 degrees, a little more. All right, and then you have extension at 0 degrees. Then you have internal rotation at 10 degrees, and then external rotation at 10 degrees as well. Next would be muscle strength or actions with restricted range of movement. So first would be flexion for the hamstrings. You're actually gonna turn over again. And then just there you go. So for flexion, all right, I'm gonna hold you here and then you're gonna go up against me, okay, ready? Go. For the hamstrings, go all the way, flex all the way though as much as possible. Okay, one more time. All right, now turn back. Sit kind of to the edge. Sit kind of to the edge so that your legs off. Like off the edge. Because you're gonna want to start like this and then you're gonna go that way, the opposite. And then we're gonna do extensions for the femoral nerve and the quadriceps. Okay, ready? Let go. 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 Perfect. Okay. And then after that, we're gonna move on to. Oh, you're gonna have to stand up for this one. So. Perfect, stop right there. So we're gonna go with neurological tests. The first one is motor, and to test L2 and L4, you're gonna do knee extension, so like what I'm doing, and then hip abduction. Yep. And then for L4, you're gonna do ankle dorsiflexion, which is up, and then inversion as well at the same time, so towards the, yeah. And then for L5, you're just gonna put your foot back down. You're gonna do ankle. No, you're gonna do toe extensions. So just point your toe to the sky. And then L5S1 is gonna be knee flexion. Or actually no, this way. Yeah. And then for S1, it's gonna be ankle eversion, so away like that. And then S1, S2 is gonna be ankle plantar flexion, so like this. No, like punch it. Yeah. Okay. Then we have sensory, so you're gonna have to look back down for this one. Go back to the. Okay, go to the camera. It's just gonna be your knee again. So for L3, it'll be the medial side of the knee. L4 is going to be the medial and lower leg. L5 is going to be here, the toes, and then S1 is going to be the lateral side. And then for the S1, it's surface of the foot, and S2's the posterior of the knee over here. And you were able to feel that?
Mm-hmm.
Okay, cool. And so reflexes, we do the patellar tendon and Achilles tendon reflex. So you're actually gonna have to. Actually, no, we'll do the Achilles one first. So hang this off a little bit. Like, can you sit more to the edge? Sorry. All right, cool. Let's relax it. And then after that is the Achilles tendon reflex. So roll over on your stomach. All right, and then last thing, go back. Last thing, I just blood flow test. So here, hold this, and make sure you can see when I do this. Okay, ready? So we'll do the toenail bed for recapitalization test.
Oh.
The color should come back within 2 seconds, and then you have the dorsal artery pulse, and then you also now have the popliteal artery pulse, which is posterior side. And then I would compare bilaterally. All right, and